Hello, everyone. We'll give it just a moment or two here to let folks get into the room before we get started. Okay, I see the rate of those joining is steadying, so I'll get us started. Thank you so much for joining us today. Before we begin today's webinar, I'd like to acknowledge the land on which Parachute is located. For thousands of years, it has been the traditional territory of the Wendat, the Anishinaabeg, the Haudenosaunee, Métis, and the Mississaugas of the Credit First Nation. Today, this land is still the home to many Indigenous people, and we are grateful to have the opportunity to work on this land. And while we meet today on a virtual platform, we encourage you all to take a moment to acknowledge the importance of the lands which we all call home. Welcome to the second event in our 2026 Toxicovigilance Canada Poison Webinar Series. Parachute is pleased to present this webinar in collaboration with the Canadian Association of Poison Centers and Clinical Toxicology and the Toxicovigilance Canada Public Outreach and Communications Working Group. Every year, we explore various topics and areas of expertise related to toxicovigilance, highlighting the amazing work taking place across Canada, from surveillance and detection to public health, communications, and response. For our second event in the 2026 series, we are thrilled to welcome two speakers, Chad Larabie and Samantha Bruin, who will be presenting today's webinar, Strategies for Effective Poison Prevention Community Outreach and Communication. Raising public awareness about poisoning as an injury issue helps reduce harm, prevent avoidable injuries and deaths, and ensure people know how to respond quickly and safely. Our speakers today will share their approaches to raising public awareness about poisoning issues and their learnings about how to conduct community outreach effectively. The next webinar in this series, Novel Drug Surveillance Sources and Current Drug Trends, will be taking place from 2 to 3 p.m. EDT on Wednesday, March 25th, 2026. And you can learn more and register at parachute.ca/surveillance webinar. This webinar will feature experts from two drug surveillance programs, Street Connections of Winnipeg Regional Public Health, a comprehensive mobile harm reduction program, and the National Wastewater Drug Surveillance Initiative of Health Canada, an interactive public dashboard that explores the presence of drugs in wastewater. Participants will hear an overview of each program, including their surveillance methods and data sharing practices, followed by information on current drug trends. Participants will also learn how they can stay informed by accessing reports, surveillance data, and drug alerts, and the webinar will be recorded. Before I introduce our speakers for today, I'd like to start off with some housekeeping items. Firstly, this webinar is being recorded. We will have time for questions at the end of the webinar, and please do use the Q&A box at the bottom of your screen to ask your questions. We will also have folks monitoring the chat for any technical issues, so if you have any issues at all, feel free to let us know in the chat box. And at the end of the webinar, when you're leaving, you'll be prompted to complete a short evaluation. This only takes 1 or 2 minutes to complete, and your feedback is really valuable to us and helps us guide future learning opportunities. So please do take a moment to fill that out on your way out. On our agenda today will be presentations from our speakers, Chad Larabie and Samantha Bruin, followed by a Q&A session. Specializing in knowledge mobilization and poison prevention, Chad leads provincial initiatives with the Ontario Poison Centre, aimed at improving public access to evidence-based toxicology information and strengthening prevention strategies across diverse populations. With a multidisciplinary background in digital marketing, public health, and knowledge translation, Chad brings expertise in public education, systems-level implementation, and performance evaluation. His work includes designing digital education campaigns, leading stakeholder engagement initiatives, and leveraging analytics to optimize reach, effectiveness, and impact. He is deeply committed to translating complex scientific evidence into clear, actionable guidance that empowers individuals and communities to make safer, informed decisions. Samantha has led the BC Injury Research and Prevention Unit's communications and knowledge translation activities since 2017. She supports a variety of projects through strategic planning, content creation, media relations, social media, and promotion. Samantha obtained her Bachelor of Arts from the University of British Columbia and holds a certificate in Public Relations and Marketing Communications from the British Columbia Institute of Technology. She has more than 10 years of experience specializing in healthcare communications at organizations such as Pain BC, the UBC Division of General Internal Medicine, and the Center for Advancing Health Outcomes. Thank you so much, Chad and Samantha, for joining us today to present your work in poison prevention, community outreach, and communication. I'll now pass to you, Chad, to begin your presentation.
Great. Thanks so much, Sarah, for the lovely intro here. Just give me a second. I'm just going to go ahead and share my screen.
Perfect. That's great, Chad. Thank you.
Excellent. So thanks so much for being here today, everybody. We're really excited about presenting. Sam and I have been looking forward to this for a number of months. And I'm going to approach my presentation more from a theoretical framework, kind of a higher lens. And then Sam will be able to actually walk you through a great KT plan and a really good practical example. So from assumption to adaptation, using community-informed knowledge to drive meaningful poison prevention outcomes. So before we begin, just wanted to give a bit of a write-up on the Ontario Poison Center. So we're a 24/7 toxicology consultation service. We're available anywhere, anytime, in any language for healthcare providers and the public. We get over 65,000 cases a year, and we're staffed by 48 registered nurses and pharmacists, soon to be 50. We also have access to board-certified medical toxicologists available 24/7 for consultation if a case becomes more complex. And we also have access to different subject matter experts. So if there's something like a snake bite, we have different experts that'll be able to consult on something like that. And then, of course, we're supported by multiple teams, including IT, knowledge translation, and education. And my role specifically is to, increase awareness. And often we do this in public health units with either low contact or high risk groups. And so these are kind of our public health units, as you can see, broken into 34 different areas across Ontario, representing more than 16 million people. And we have dashboards that are able to look at the total call volume in relative proportion to the population within a public health unit. So as you can see there on the right. And that gives us more insight as to which areas may be low awareness or may be contacting us more. And at the same time, we can also see trends as well in poisoning. So some areas may have a certain poisoning more than others, and this just gives a lot more insight as to how we kind of approach our community outreach. So before we begin as well, as we can see, clearly there is a changing information landscape, and this is happening at an exponential rate. The rise of misinformation and disinformation with AI-generated content is getting really extravagant and complex, and a lot of the algorithms are actually driving this forward. So we actually see that false information is 3.5 times more likely to get engagement than actual factual content, which is really concerning. And also, there's a new trick that people are doing, which is they're purposely creating inaccurate content to drive engagement even more because it provokes the person that's actually reading the content. They'll comment, this is inaccurate or this is wrong. And all that does is drive revenue for that person that's posting it. So it's just a lot of things that are getting, propelled to the top are things that aren't necessarily helpful or evidence-based. And of course, polarization and extreme viewpoints are that same component where, the most toxic sometimes and the most interesting or the most extreme things are getting pushed in these algorithms to the highest level. And, then of course we have this being misled and faulty advertising as well. So there's just a lot of things to unpack here. But meanwhile, all of us are trying our best to be academic and it's harder to remain credible, accessible, evidence-based, and tailored to these audience. So there's just a lot there. And so the bottom line is, short form content, social media, mainstream media are increasingly winning that attention economy, while kind of traditional things like publications, other than the academic community, continue to see kind of decline, reach, and influence. But it's not all doom and gloom. We can still be competitive, and there's six main things that I wanted to talk about today, which is understanding communities, segmenting and tailoring your strategy, leveraging your partners and your experts to really scale and be more credible, co-create with your communities and really streamline collaboration, design for modern platforms, and then evaluate what matters. So not just going just into the numbers, but everything else around it. So let's start off with understanding communities. So generally in organizations, we want to move fast, we want to check boxes. A lot of times there's a top-down design, with little to no end user input. And we make this assumption that knowledge is translational. So this person's really intelligent, they have a lot of degrees. Well, they must be able to use that knowledge and make a prediction of what's happening in that community. But that's not always the case. And in other industries, this would really never happen. So if we look at video games as an example, they're user tested by thousands of people over tens of thousands of hours with constant testing before launch. And there's a lot of studies that kind of show that those that have more user testing do better and are more well regarded just because they've worked out all the kinks, they've looked through all the errors. And so, if you think about the importance of that from a video game, yet resources are often made without involving the end user or different expertise. And so the bottom line here is if we don't involve those users early, we risk, unintended outcomes, scrutiny, and it could really lead to larger mistakes later. So there's lots of ways that we can get more insight from communities. Of course, you can do surveys, focus groups, interviews, different informal conversations, scans. You can test and pilot strategies. You can co-define problems and solutions with different groups. And there's so many things you can listen early to understand their context, their priorities, realities. But ultimately, it's really just about showing up, making a phone call, and listening. And learning something is always better than not learning at all. And I know from a lot of us that don't have a lot of time and resources, sometimes this becomes intimidating. Well, I don't want to do this huge project because it's going to cost 4 months of time, and there's going to be all these different, people that will need to engage. And so it becomes kind of intimidating where you might not start at all, or you might just kind of rush to get something out. But I think the bottom line is that there's not really necessarily a wrong way to approach this. As long as you're getting some feedback, that's the kind of the bottom line that I'm hoping we can gather from the conversation. And with that, when we were out in the community, there's so many things that we've learned that only being on the grassroots level would we actually be able to understand it. So we've been to a lot of different shelters. Reason being is that we see in the Peel region that there's very few people that kind of contact us there. And we think a lot of reasons for that might be, the absence of multilingual resources. So a lot of people that only speak English or French, or that don't speak English or French that are not able to kind of, know more about our center and our service. So anyways, that's, given us opportunity to go inside shelters, and we see that, there's more to it than just that. Their fear of contacting our services for cost, didn't know that it was free, even legal. People are afraid about children's aid. A lot of times these shelters are, 200 square foot rooms that host a family of 5 or 6. There's also limited access to safe storage. So, the bathroom, the kitchen, and the bedroom are all side to side. And traditional resources that we have may actually be irrelevant. So things like fridge magnets, to have our number there, there's actually no fridges that are located there, or even different resources like poison proof your home showcase, detached homes. Well, it's not necessarily inclusive in that case. Or even infographics that we might have shown, people said, well, we'd rather have this in the form of a storybook for our children at night. So these are just things that we really kind of you pick up at the ground level. Same thing with, newcomers. There's different cultural differences. They might not want to have a number. They might want to actually visit an emergency department or the primary care provider. We've also talked to people that were undocumented and didn't want to call because they were concerned about that immigration status. Again, the lack of multilingual resources make it more harder to understand. And then these are just all examples, but even like the elderly, and this is a little bit more known, but low engagement with digital tools, things like QR codes aren't necessarily the most helpful. So just some different insights there from the community. And of course, that kind of brings us into our next part, which is segmenting and tailoring the strategy. So, segmentation is not optional. Different groups have different risk exposures, different access to tech, different language, literacy, time, willingness to engage. So, if we think about youth, TikTok, short videos, content, pure voices. So, really, ultimately, it's not about the reach, it's about the relevance that's necessarily going to drive that uptake. And from my time, you might have a superficial strategy that's broad, might not be targeted. You might get a lot of impressions, but you have low engagement, and vice versa. If you're more tailored, you may focus on a specific group, but then you'll have that higher uptake. So the bigger and less targeted your message, often the lower the likelihood that people will act on it. So right message, right tool, right audience. And so it's really about precision. Another key piece is leveraging those partners and experts. So we really want to build that trust and transparency with communities. And when you have all these different experts involved and these different partners, it really strengthens that credibility and that relevance of information shared. They might not know who the Ontario Poison Center is, but they might know another organization. Also, the right people there are doing the work, so you can cross-reference with other experts to make sure that a data is understood properly or that context is really understood well. You also able to maximize your impact by adage reach, scale, marketing. There's also more uniformity amongst those partners, so you don't have to then, recreate the wheel another time if you're making a resource. It improves the quality of the data and that insight, and then it reduces risks and mistakes. And I have a few cool examples I want to share with you of some big mistakes I made in my past. But the bottom line there is without the right expertise, even well-intended strategies may miss the mark or worsen outcomes. And if you look at that image on the top right, that was a resource I created when I was part of the Ontario Neurotrauma Foundation, which went to show that after 2 weeks of not recovering from a concussion, that you should follow up with your primary care provider. And that was listed in red. And we started getting, different emergency physicians writing in through the QR code and through different things that we had set up. And they were saying that we think this is kind of creating hypervigilance in our community. People are coming into the Emerge and showing this resource that, hey, I'm still not better. And they're panicked because of the color red and because of the way that we didn't necessarily say anything after the 2 weeks. And so if we would have had, more perspectives, potentially even somebody that, had expertise in color design and psychology, that resource would have been better. And actually, that might worsen outcomes because now more people are coming back to the Emerge when that wasn't your intention, right? Same time here, a lot of times, work with a lot of patient partners and their lived experience is fantastic and different expertise they bring is great. But sometimes, they might also advise on design or marketing. And, that's not necessarily their expertise. And so, it's just good to get the right people involved. Another thing we ask is to members of the public is how would you want to learn about the Ontario Poison Center? How would you want to know it would exist? And a lot of times they'll say things like social media, but they're not necessarily the experts in psychology. Maybe they actually don't know how they would want to pick up the phone themselves. So this is just a lot of things to ensure that the right experts are doing the right things. And that leads me to my next point, which is uptake is really complex. So people are messy, relational, emotional, and context driven. There's this great book by Rory Sutherland called Alchemy, the Dark Art, Creating Magic. It's really, really great. And what you're going to find here is he comes up with a ton of different examples of how people, what you might think is logical is not necessarily what is going to come out of that. So it talks about fancy envelopes. So there is a marketing company that wanted a higher amount of people accessing their content. And when they put their brochure in a fancy envelope, more people actually responded to those letters. So really perception beats content. Of course, fewer words. Sometimes there's these huge documents, 20 pages long, and you're like, let's reduce it to 15 pages. But maybe the answer is to reducing it to a paragraph or a page. And so it's just really sometimes to think about how to completely transform something. Decaf coffee, they rebranded as Smooth and Mellow and actually saw increased sales from that because supposedly a lot of people, thought that decaf coffee was kind of a wussy way of kind of approaching coffee. They should just had, oh, well, you're not strong enough if you can't drink real coffee. So it's a perception issue. Hotel toiletries, putting hotel soaps in a glass dish. all of a sudden people thought this was more valuable, even though it was the same soap across multiple different hotels. Lottery numbers, people prefer, numbers that they feel are lucky over random odds, even though those random odds might actually be in higher favor for them. Ticket line experiments, seeing a line that has a lot of people in it, like you would back in the day at a club, makes you want to go and stand in the line, even though there might be empty inside. So all this stuff is kind of just makes you think outside the box when you're kind of creating. And so you really want to consider perception, emotion, identity, not just fears, logics, or efficiency. And of course, there's still not a lot of expertise in this area, but it just makes you really think more about it. And when we're dealing with the communities, sometimes you can kind of tease some of these things out. Co-creating with communities is another really important one. So you really want to involve partners early on and often. So from planning to evaluation, full life cycle there. It will really just help with that buy-in, and then following up with the results that you've got, setting clear standards and processes so you can just continue to iterate forever if you don't have processes and kind of things in place to make sure there's just a few touch points to make sure the right people are getting back and so forth, aligning on goals and outcomes. So from the very beginning, what are we trying to get out of this? What does success look like to you, and what does it look like to us, and how do we agree on that? Coming in to develop those feedback loops. And then, of course, documenting everything. So when you have a project proposal or everything in place from the beginning, then you can always go back to that document. So if there's anything confusion halfway through the process, you can always go back and it can be kind of clear for everybody. So, co-creating with communities is a great opportunity, but it really involves a lot of work. Another big thing here is designing for modern platforms. So we really want to start, with visual first, infographics, icons, short videos, simple layouts, really communicate a lot faster than dense text. Anything that's shareable, if somebody can screenshot it or if they can send it quickly to someone else, that's a great opportunity as well. Story-driven communication, so real examples, narratives, help people better understand risk and also remember the messages. And Rhaenyra Narendez runs a great KT story telling workshop through Sick Kids. So, that's also a great opportunity if you want to learn more there. Plain language, of course, is super important, but sometimes people simplify the language so much that it actually loses the integrity of what the message or the research is trying to convey. So simplification, of course, is important, but just not trying to scale it down too much because then you also might lose the plot of what that message means. Mobile friendly. So, if I look at our Ontario Poison Center website, we have 2/3 of our users are actually accessing our site through their phone. So that's just another big piece here when you're designing content. You really want to make sure, whether it be your website, social media, or what have you, resources that, really think about the access from the phone. And then, of course, want it to be action orientated, just so that people can actually take steps so that it's meaningful. And if, evidence is hard to understand, really hard to remember, or hard to share, it will not translate into behavior change or uptake. So that's important. And then, of course, evaluate what matters. So, it really goes beyond reach. A lot of time people say, this resource or my campaign had 1 million impressions, but that really doesn't tell us anything, whether anything changed. We want to look at multiple indicators and evaluation domains that tell us the whole story from exposure to action to change. So, and this is a knowledge translation planning template that's adapted by from Melanie Barwick's KT planning template tool. And the few things that we look at is not just reach, engagement and usefulness, use, and of course, impact. And I want to share a story with you because this is a lot of times what we hear, when we go out and we talk to people, different things. So when I say evaluate what matters, sometimes people say, hey, I created this video to promote a new resource, and my video had 100,000 views. And you're like, wow, 100,000 views. So great. Let's dive into those 100,000 views. Out of those 100,000 views of that video, how long did people actually watch? Were the views driven by paid ads or organic interest? How many people liked, commented, or shared that video? And then, when we move further down the chain, we see that, hey, only 1,000 people actually watched the video for more than 30 seconds. And you needed that fully 30 seconds to understand what that video was portraying. And of those 1,000, only 250 people clicked that resource link in the description. And of those 250, only 75 downloaded that resource. And of those 75, 30 saw your QR code and completed a follow-up survey. And then of those 30, 15 said the resource was useful. Some other people might have actually thought it was not as useful. Then six reported they're currently using it, and then three of them agreed to a follow-up conversation. So you go from 100,000 to three when you think about real impact. Now, it doesn't mean that those three aren't important. It just means that that's really where the opportunity really lies, because those three conversations may then turn into, a whole implementation thing where like maybe that resource gets implemented in their nursing unit or whatever it might be as an actual protocol. Uh, Partnerships might come from that, or maybe that's where system improvements begin. That's the starting point for that. So that's why we want to look at multiple indicators. We don't just need those quantitative metrics, the views, the downloads. We really need that qualitative insight as well. So bottom line here, goal isn't just exposure. It's really the beginning steps for change. So thank you so much for listening and for being here. And I will pass it off to my partner in crime, Samantha Bruin.
Thank you, Chad. Yeah, I was frantically taking notes during your presentation. I was learning so much. Um, but also, I wanted to say quickly that that concussion infographic you used is one that we use over here in BC through our concussion awareness training tool. So, thank you for that one. We found it useful. So as mentioned, I work at the BC Injury Research and Prevention Unit, which is based at BC Children's Hospital Research Institute and the University of British Columbia. Today, I'm going to talk to you about a campaign we did last year on button battery safety. Oops, my slides are going. So you'll notice that my slides will look a little bit different from the traditional slides. That means I'm using the assertion evidence presentation method. Um, you'll notice it's different. See what you think. So before I start, at the unit, we've been making a point to go beyond traditional land acknowledgements to kind of try to be more thoughtful. So I'm calling in from Vancouver, and around this time of year, on the West Coast, we see cherry and plum blossoms start to bloom. This picture is of a residential street in East Vancouver, and the blossoms are beautiful, as you can see, beautiful and pink. So I thought, how did these trees come here? I looked up this history and I found out that the Japanese government has been gifting the city of Vancouver these trees for various times throughout the last 101 years. So the first time it happened was in 1925. And then I thought, I started reflecting on the original owners of these lands, the Musqueam, Squamish, and Tsleil-Waututh peoples, and for how the they didn't see these trees, they didn't have them at the time, but obviously they still thought their lands were very beautiful and fruitful. Um, so I just was reflecting on that and how, as you know, an immigrant, a family or immigrants here, so just thinking about all of that and how we can all come together. So this presentation will use our 2025 button battery campaign as a success story of community engagement and KT. I'll talk about strategies and channels that we used, the benefit of utilizing your networks, and what we learned and how that can be applied to future campaigns. And before I start, I want to thank my colleagues Neil and Moshgan. Um, they're on the working group for button battery safety over here, and they're really the brains behind all this. I just do the flashy stuff. That they do all the research, they're doing all the advocacy work. Moshgan is on the call today if you have specific questions about that work as well. I'll cover it briefly today. So um, button batteries, obviously, if for those of you that know, they can be found in hundreds of everyday household products, some of which I've listed on the screen, and the number is growing each day. Ruth Barker, a pediatrician from Australia, calls them landmines in lounge rooms. For those of you that don't know, when a button battery comes in contact with body tissues, it creates a current, which causes burns and damage inside the body. Technically, that's not a poison, but because it's ingestion of that, I think it's categorized as a poison. Symptoms can be delayed, but pretty much immediately, the button battery starts causing damage inside the body. The Canadian Pediatric Surveillance Program um, did a cross-sectional survey of pediatricians, and they found that there's about an average of 2.7 button battery cases per pediatric physician per year. We are inspired to act by the real life stories of children who are affected by this problem. This is Amelie. She's a child from Red Deer, Alberta. She swallowed a button battery at home in 2020. Thankfully, she's made a recovery after multiple surgeries, but obviously her injury could have been prevented. So we formed an ad hoc working group in British Columbia to focus on button battery safety. This group comprises of individuals from the regional health authorities, the unit, us, and the BC Drug and Poison Information Centre, also known as DPIC in BC, DPIC. So we're focused on three things in our working group. The first is policy change. Hopefully some of Health Canada folks are on the call. Thank you for reviewing the regulations around button battery packaging. We put in some feedback. We coordinated a provincial response and sent in a letter for the call for feedback and hoping to hear back soon. We also published a manuscript looking at poison center data with our colleagues at DPIC. And finally, the thing I'm going to talk about is public education, educating the public on the dangers of button batteries and what they can do. So on the public education piece, we had two objectives for our plan. One is to understand what British Columbians, focusing on that parent and caregiver audience, children, those who take care of and have children under 6, what they know about button battery safety. And then second, using those findings to increase their knowledge to respond to a potential incident and also to prevent the incident from happening in the first place. So we created a survey to understand what people knew about button battery safety. We consulted with investigators from Sick Kids Hospital in Ontario and based our survey questions on a similar study that they did in 2022. Our survey was open from January to March 31st. And if you completed this survey, you were entered in a draw to win a $100 gift card. There's the poster on the screen right there. We had a QR code. We had a bit.ly link, a small link, so it's easy to share. And those posters and little social messages were put out. We focused our results analysis on public responses, even though we did collect demographic data on practitioners and things like that. We had a two-pronged strategy for this campaign. So the first one is specific messaging about the survey, getting people to actually fill out that survey. That's the blue box there. That was from January to March 2025. And then secondarily, during National Poison Prevention Week in March 2025, we had a separate strategy promoting the key messages of the campaign, safety messaging, prevention messaging. And we actually used the preliminary results of the survey in our outreach efforts, which I'll talk about. To do this, we had separate campaign toolkits for the survey and one for the education campaign, and those were shared. We really relied on our partner organizations. This is one of the things that Chad talked about in his presentation to get that survey out there across the province. So I know it's different in every province, but in British Columbia, we have 5 different regional health authorities, one for each kind of region of the province. So Vancouver Island has one, for example. There's Vancouver Coastal, Interior, Northern, and Fraser. The regional health authorities were all given the campaign toolkits, and then they were given the direction to just share it widely. And we're happy to say that each of them shared it in their own way. So, for example, in Vancouver Public Health, Vancouver Coastal Health, there was posters put up in libraries promoting the survey. Island Health did a media pitch. There were internal newsletters. Northern Health had digital billboards, and their emails were sent directly to daycares and early childhood educators as well. At the end of the survey and on social media, we directed people to a dedicated web page on button batteries so people could learn more about the issue and see the answers to their survey. We also created a 2-page handout, which is available on our website, with the same information that could be printed and shared for those who like a more tangible piece of knowledge translation. So I'll talk about some preliminary results. We heard from more than 1,700 British Columbians. The majority of them interacted with children less than 6 years old. Almost 40% were parents and primary caregivers. Interestingly, 12.4% did not know that ingesting a button battery could cause death or serious harm. We were we suspected that safe storage could probably be improved. 30.3% of folks said that they just store their batteries in a drawer or leave them loose or lying around the house. Fewer than 50% they would call DPIC in the event of possible ingestion. I think one of the key messages is that we want everyone to call DPIC. Often in the medical field, if you go to the emergency or the emergent care center, that the nurse or doctor would call DPIC anyway and ask for advice on poisoning sometimes. So we wanted that number to be 100%. We also asked respondents to tell us what they would do in the event someone did swallow a button battery. So this graph shows the responses. The X's mean that that's the wrong thing to do, and the check marks mean the correct thing to do. Um, so concerning was actually that only 2% of folks knew that honey or jam is an effective way to delay serious injury while seeking help. The recommendation actually is that if someone swallows a button battery, you're to give them honey or jam to coat the battery inside the body while you're waiting for help to arrive. That can reduce the amount of burn in the body while you're waiting. This number did increase slightly among those who identified as parents, but only by a little bit. I think it was like 2.2% among parents. The other thing that we found concerning was that 15.5% thought the child should be forced to vomit or throw up, which is obviously wrong. So armed with the results of this, we used the key messages from the campaign to inform our public safety campaign during National Poison Prevention Week last year. So we focused our campaign efforts during Poison Prevention Week actually on button battery safety. The objectives were twofold, to one, increase uptake of the survey to get those final results before the survey closed in March, and also to educate the public, obviously. We had a media release go out with our partners at Provincial Health Services Authority. We highlighted preliminary findings, like I said. We used the DPIC data on the number of calls, and we included that in the media release to kind of draw attention to the issue. And our partner organizations amplified the message once again with articles of their own, sharing social media messages that we provided them in the toolkit. There's on the behind the image, the secondary image in the back is Provincial Health Services Authority sharing the social media message with all of their followers on Instagram. And then Island Health did an Ask the Expert Q&A, and they also had a media pitch go out to some of their reporters locally as well. Our media outreach efforts resulted in more than 10 stories, including Global News BC. There's our director, Dr. Shalina Baboul, talking with the host on the Health Morning Show, as well as radio stations on Vancouver Island. So I think that was a success. But in this year, we're going to renew our public education campaign. We're going to refresh the images and messages and add a couple of more key points based on our fulsome analyses of the survey results. And we'll also continue to monitor and engage with Health Canada on that policy change and the packaging limitation that I talked about earlier. So I was asked to include lessons learned from the project. I have 6, so I'm going to go through them. I'll be quick, I swear. So number 1, with the right connections, you can reach people with little to no budget. We had a budget of staff time and $100 for the gift card. That was it. Obviously, there would have been a lot more things I would like to do if we had a little bit of money for this campaign, but work in public health, so resources are limited. But with the health authorities and DPIC with us, I think that we were able to get the results that we got, that wide reach, the 1,700 responses, even without that budget. Number 2, Chad mentioned this in his presentation, involve all partners from the beginning. Basically, if you tell people you're going to do something last minute and then you ask them to participate, it's not as likely that they'll do it, right? If you involve them in the beginning, ask them, what do you need from me to do the campaign, to share the messages? What kind of materials do you like? Then they're more likely to take it on and say, okay, we'll help you. And that's what we did. We sent all the materials early. We followed up with them a few times. We said, hey, what do you need? Is this good for you? Do you have any questions for us? And then that helped them promote it better and more widely. Number three, if you don't have any money, if you have a little bit, you can offer an incentive. Like I said, we offered a gift card to those who filled out the survey. I think that really helped people get incentivized to fill out that survey instead of just asking them just to do out of the goodness of their hearts. Number four, make it easy for stakeholders to share your content. We had a campaign toolkit. You'll see it on the screen. I had some images. I put them in a Google Drive, easy to access. It had various different images and texts that obviously could be shared and changed around as people wanted, and I customized it to different platforms, so it's extra easy to use. Five, using your networks to do a media pitch to the news media can be free promotion of your public health message. I don't know if you guys have connections to journalists or the health authority or government that has those connections to journalists and news media. But I found that if you can get the promotion through the news media, it's a fabulous way to get your message out there. Lots of people watch the news, lots of people read publications online. It's a great way to get those key messages shared for free. Um, I will say that media releases are, with a grain of salt, right? I've had media releases go out and they fall flat. No one picks them up. Only the small newspaper in a tiny town picks it up. Okay, great. Um, Others have been canceled or changed by breaking news, for better or for worse. Um, and obviously, there's always the risk that the journalist will take your story and sort of change the words or not report on what you need. Your key messages properly. Oops. Here we go. Finally, let your audience help you inform your key messages. This is part of that stakeholder engagement, if you can have it. There are different ways to do this. I have a few on the screen as ideas. Do what we did, do the survey to identify gaps in knowledge, and then use those results to share the messages that are missing. Use what you learn from the literature. Do a Google search, lit search, gray literature search, see what you find. See if you can talk to folks that actually talk to people in the community. So, for example, you can talk to the people at the poison centers. What are the questions do they get at the poison center about your certain issue? Do physicians or doctors talk to patients? What questions do they have about a certain vaccine or what have you? And finally, you can just ask your family or friends at a dinner party, hey, I'm thinking of doing a campaign on button batteries. You have young kids. Did you know about honey or jam? So I wanted to leave you with kind of what I use to create a good public health message. So I try to think of the following structure, and those are the three boxes on the left, the building blocks I want to say. So essentially, you want to get their attention somehow, whether that's through an interesting fact. Or an interesting message or a video or a picture. Provide that context and then provide that take home message. So the first thing I say is the say what section. Let's I call that the hook. So that's an interesting fact or tidbit that could kind of draw their attention. So for button batteries on the second column, it's even a dead button battery can cause harm if swallowed. Or regular household items can look interesting to kids, including cleaning products. Next is the who or what. That just grounds the post in who or what you're talking about. So curious young children are at risk of button battery poisoning. The who is the children and the what is button batteries. Or over half of all calls to the BC Poison Center are in kids under 6. Sometimes a statistic can help with this. I'm a little bit careful about how I use statistics. I think sometimes in public health we get overly reliant on statistics, whereas in fact the average person only has a basic knowledge of statistics. So sometimes I think we get bogged down with adding too many points and facts and numbers, and that can be distracting. Um, I read somewhere that people think that 1 in 10 is the same as is not people think that 1 in 10 is not the same as 10 in 100, which it is. So I have some interesting links in the references on the public perception of statistics. So I can give a whole webinar on that. But hopefully the references help. And then finally, the how. And that's the takeaway, right? That's the prevention tip that you want to get across. So how can they prevent injury? Store all batteries high up and locked away. Dispose of dead batteries at your local recycling center. Or get down on your child's level and lock up all potential poisonous items in your house. So with that, I want to thank you for listening. Our social channels are there. There's the QR code that links to our button battery safety page, so you can share it with your colleagues. I'll put it in the chat as well. Thank you.
Thank you so much, Samantha, and to Chad as well. These were excellent, thoughtful presentations. I'm going to just get myself set up here for the Q&A, and I'd love to open the floor for Q&A. So a reminder to our audience, please use the Q&A box to submit your questions. Okay, I think we do have a question come in here. So this one is about button batteries. So over to you, Samantha, for this one. Is it correct for button battery injuries to be categorized as a poison, or should it be its own category entirely?
Great question. Uh, maybe I'll defer to my colleague Moshgan, who's has medical training.
Perfect. And here's Moshgan. Perfect. Go ahead, Moshgan.
Thank you, Sam, for your great presentation. I believe that it can be categorized as bottom battery ingestion. At the same time, I agree that Poison Prevention Week is the best time to promote this. And like for making it understandable for the public, it would be okay to lean on part of the mechanism of injury, which is poisoning, which is not the only mechanism. But that is a very good and valid question, which we have addressed before and discussed. And yeah, and also Neil is on the call, who has been championing this work in the province. If he has further thoughts, I would be happy to hear. Thank you.
Oh, yeah, thank you both. No, I think you captured it perfectly well. Yeah, I mean, it is a poisoning. It's a chemical poisoning, obviously, because it's like a bleach or something causes a caustic burn. But I think we still generally, yes, as you said, Mojgan, consider it to be a poisoning.
Awesome. Thank you so much, all three of you there. Okay, we have another question here. This is for Sam as well. How do you conduct the survey, or how did you conduct the survey that you spoke about?
Yeah, at BC Children's Hospital Research Institute, we have access to a software called REDCap. It's just a survey creation tool. There's that. There's Qualtrics. I think SurveyMonkey would be also fine. So yeah, we had to get, I think we had to get, did we get ethics approval for that? Because it was a research study, right? So yeah, we had to get ethics approval for that due to our affiliation with the University of British Columbia.
Awesome. Thanks, Sam. Okay, a question here for Chad. You touched on the changing information landscape being a challenge that we're all coming up against, AI-generated content being increasingly common, mis and disinformation continuing to be an issue online. Could you tell us a little bit about some of the more common topics you've seen coming up that involve problematic or inaccurate information at OPC? And how are you at OPC trying to combat that problem or that topic?
Yeah, we've had a few interesting kind of things happen. So I forget exactly where it was, but there was somebody that actually put a AI generated book about mushrooms, mushroom foraging, I think it was, which was inaccurate, completely inaccurate. And they were actually selling it online, I believe. And so, the great thing about that is, we have a lot of partnerships and things. So that was something that was immediately flagged, to our partners. I think Parachute might have even been, involved and just, trying to calculate the next appropriate best steps. So, different things like putting out, messaging, of course, not just through social media, but really, even from our biggest partner possible. Other things we've seen was, if I think it was with acetaminophen, where there was a lot of discussion about it being really bad, in the States for that brief period of time. And I think they kind of blanketed saying that it wasn't necessarily useful in different perspectives. And then people started a social media trend with pregnant people that were actually swallowing Tylenol pills. Um, and, of course, this is something we have this initiative kind of see something, say something. So it was brought to people's attention. But when we followed up on the calls, there didn't seem to be, many people that were having, pregnant mothers in ICU because of swallowing too much acetaminophen. But it's just all of these things, whether it be, AI or different trends or, faulty information that's just kind of concerning. And we don't necessarily have the bandwidth from the OPC's perspective to do much about that, but we definitely can help be just a piece of the puzzle and keep our eyes out there. So, yeah, just a few experiences on this sense, Sarah.
Thanks, Chad. I have a question here for both of you, Chad, Samantha, and of course Neil and Majkan. Please do feel free to chime in as well. We hear from partners often that being limited in resources is increasingly a barrier in the world today. So I'm curious about what your top piece of advice would be around conducting effective community outreach with limited resources for those coming up against this issue. I know, Samantha, you mentioned in your presentation that this excellent campaign that you conducted around button batteries was accomplished with very little funding. So yeah, curious about your thoughts about what you would advise.
Do you want to go first, Chad, or?
Yeah, for sure. I'll follow up after.
Okay. Yeah. So yeah, like I mentioned, the survey is a good way. Like I mentioned in the my last second last slide, I think it was like the different ways you can engage with community. But here at the unit, when we have a project idea, we see what we can do, right? And it part of our mandate is to do some work on community outreach. But if there's something that's particularly interesting, we do look at other sources of information. We do get a nice, healthy group of student volunteers who come by wanting to get some experience. Sometimes we put them on a project like that, gathering a mailing list. One of our students did a mailing list for uh, childhood educators and daycare centers. So they compiled that list for us. We take advantage of the university's work learn program, and those students we get a subsidy back for their salary, so we are allowed to have students to help us with that work. And the last thing I'll say is using your networks, right? Like I said, we all have connections in community, and they're probably more on the ground, talking to people and the community more than we are. So we just use them to kind of get that message out there. And like I said, engaging them early is a great way to ensure cooperation.
Yeah, that's great, Sam. So I obviously echo everything that was said there. And I think there's other pieces as well, like maybe when it comes to design and things to that nature, there's some really cheap programs out there like Canva, like CapCut and different video platforms where, if somebody just has access to a phone now, just a current Apple phone, or there's a lot that you can do, shoot things in 4K quality, 60 frames per second, what have you. So there's a lot of things that I think are available at people's fingertips that weren't before. And so, even from their social media, as much as you can have a designer and you can have a web expert and you can have all these expensive programs, there are ways to, just make it a lot bit, easier to do. So that's what I would add to that. Thanks, Samantha.
Thanks both for those thoughts. We have another question here around the survey piece. So, what do you do if people feel over-researched or over-surveyed because of several surveys taking place with the same audience? Is this something you've come up against, or how might you approach that?
I have not come across that personally. I do know that, yeah, there are lots of surveys out there. Part of it, I think that we try to get around that was having that incentive, right? That gift card draw. I mean, a lot of there's companies that poll people on a regular basis, and you can enter the pool of applicants who can do the surveys, and then you get points towards incentives for that, right? Or focus groups will give you money. There's some people that do that all the time and some people that do that not that often. I think that there's a healthy mix of those folks that you could capture. Moshka?
Thanks. Yeah, please, Moshkin.
Yeah, I wanted to add that this fatigue can happen when we work with a panel of respondents, and that would be true. So one way is to have concise questions. Like it's always tempting to add more and more questions to get more and more data, but having concise, very clear questions usually helps to like decrease that fatigue level.
Thanks,
That's a
Moshkin.
great point. I think our survey was like less than 5 minutes, and that's just easy to do, just on your phone.
It's a great point. Yes, thank you very much. Okay, we have another question here for the button battery campaign. The question, and there's a bit of context. The question is, have you considered adding grandparents, aunts, and uncles as a secondary audience? And there's a bit of context here. So in Alberta, there was a learning from the Poison Center colleagues when running a cannabis poisoning campaign related to safe storage, that awareness of safe storage is quite high in parents, but not so common amongst the grandparents, aunts, uncles, or family members visiting the child's home.
Yeah,
And
and this
that
is, yeah,
sorry, that
sorry.
group is often, sorry, just reading here. That group is often giving gifts that may have, for example, button batteries in them and may not be aware of that as being a risk. Yeah, sorry, go ahead, Samantha, with your
No,
thoughts.
yeah, I was just excited about answering. Yeah, absolutely. Obviously, yeah, Chad talked about segmentation, and I think that that's 100% the way to go. We have another campaign that we do at the unit. It's the uh, period of purple crying. Essentially, it's just to remind parents and caregivers, and I emphasize caregivers, that if their baby's crying and you're finding it overwhelming and stressful, to not, you know, harm the baby inadvertently through shaking them. You can put them down in a safe place and walk away. So, the campaign started a long time ago as like only for parents, but I think we've evolved our messaging around that to reach caregivers, including grandparents, because we recognize that in blended families, folks, yeah, rely on their parents or aunts and uncles or babysitters to take care of their children. With the button battery specifically, I was going to say, this is something that I think we can take into our 2026 campaign. We did focus in the survey on caregivers as well, asking them in that demographic, but messaging could be put out. It's all about segmentation, right? So we have kind of a Seniors Falls dedicated social media network, so we could put a message out on there about button battery safety among seniors. Hey, if you're going to give your grandkids a gift, make sure that button batteries compartment has like a screwdriver, things like that.
Awesome. Thank you, Samantha. And I have a question here as well, and I'll open this up to everybody. Samantha, maybe I'll come to you first on this, as you shared such a in-depth example of the button battery campaign. Wondering if you could tell us about any challenges that you came up against in the process of the campaign, and how you approach those solving those problems.
Yeah, I have two thoughts. The first one is that, like I mentioned this earlier, but our budget was limited. Um, there were things that I thought would be beneficial for getting the message out if we had more money. So an example of that is social media ads. Facebook and Instagram allow for direct targeting by age and demographic. So if we had like a couple $100, we could have done the targeted message campaign towards like parents of young children or even grandparents. And the second thing I was thinking about is that the we did because we didn't have the funds to segment, we had to do a widespread campaign. That means we had one type of messaging across all channels. So then that probably limited our reach because we didn't allow for that segmentation. So then we just had to rely on one type of message, one image type, just going out to everybody.
Awesome. Thank you so much, Samantha. And Chad, I'm so sorry. I teased that I was going to ask you, let me ask you quickly, we only have just a minute here, whether there's any challenges outside of those you already shared in your presentation that you'd like to address with our audience here.
Sure. Yeah, I think the biggest thing for us is just like having really solid data-driven insights. Especially from the community. A lot of times, even when we're, let's say, making a multilingual resource or something, we want to go beyond English and French. We really just want to have good demographics, understand, the people better before making that decision. And that can be really challenging to actually finally come to a decision because there's so many variables and so many different contextual things to consider. And that continues to be a challenge. So we still haven't really figured that out, but it's just something to note and to try your best with using data and having all the different forms and all the different context.
Thanks, Chad. Thanks. That's a great closing thought there. We are right at time. I just would like to remind everyone again that we have one more webinar in this series this year, Novel Drug Surveillance Sources and Current Drug Trends, which will be taking place on March 25th. So once again, you can register for that at parachute.ca/surveillance webinar, and we certainly hope to see you there. Thank you so much to our speakers today, Chad and Samantha. Excellent presentations, really great information and learnings. And a reminder to our audience, please do fill out that evaluation on your way out the door. It is so helpful for us as we go forward with our future webinars. Have a great day, everybody. Thank you.